teach through questions. And I did talk a little bit about an inquiry based approach. Tell us about that one.
Well, teaching through questions, I mean, we in EMS, we solve problems, right? How often? Again, that's a rhetorical question. We solve questions to problems every day. Nursing has used this over the years. So again, we don't have to reinvent the wheel in what we're doing. And when we're teaching through questions, we also need to have the students earning the right to be in class. The big thing with the flipped classroom and what people don't really understand with it is the pre-course work, the readings, the lectures. We're now holding the student accountable for what they should be doing, whether it's giving them an assigned video to watch, lectures to read, lectures to listen to. And when we compare that to lecture style learning, that's low level recall. And that goes back to point one, that false sense of comfort. We should be prepared and preparing these students to be ready to function in the classroom just like they would whenever they are on the call. And I've struggled with this over some times. I'd have the students say, and I probably started flipping the classroom around in 2016. I know you and I had a talk shortly after I started doing it. It was a little frustrating because the instructors were fighting it, the students were fighting it, and then you hear students say, "I'm teaching myself." And I never had a really good answer to give them. I knew that wasn't what was happening. And then I went to the NEMSI conference this August in Reno, and one of the presenters made the comment, "Well, if you're teaching yourself, then I can go on vacation, come back a week or a month from now, and let's see how prepared you are in passing the exam," which is one good point. And another good point, and another presenter made was, "We're teaching you, the students, how to learn. You're not teaching yourselves. It's just a different way that we're teaching you how to learn."
I think the Reno conference this year was one of the better content wise that I've seen in a long time. Everybody really enjoyed that. When I started doing this, I'm I'm not risk averse at all. I'll give anything a try. And when I started doing this, I had scenarios. Students were working in groups, and I brought in medical, textbooks. I had Harrison's and Tintinelli and all these resources, and some papers printed out, some research. And we got through, and I said, "Okay, there'll be a test next Tuesday." This was a Thursday class. And they raised their hand. "How can there be a test? You didn't teach us anything."
Right.
And it's like, no, you learned.
Yeah.
That's what it's about. And it does take a little bit. And one of the things is, I think we can't let them see us sweat or doubt it, right?
Absolutely.
We have to be sure that when we go in, that we have a plan for this and that they're learning. If they see us hesitant, they'll be even more hesitant.
They will. And these students, they're going to be awkward. They might feel embarrassed. They might feel uncomfortable with doing these activities. But we know that those that have flipped the classroom, those that have gone away from the lecture style learning, we see how important and how much better the students are prepared in passing the class and passing the national registry exam. Um, the students will come across sometimes and say, "You're wasting our time," because like you said, I think if they see us sweat, or if the instructors aren't buying into that concept, then that gives the students a reason to question what we're doing. And can't we just go back to the other way? I really learn more from the lecture style learning. And we know that's not the case. These activities have to be multifactorial. We have to encourage the critical thinking, as we talked about before, and we must demand these students be able to problem solve in the classroom and in taking care of our patients.
I think that there's a painful reality here, Chuck, for you as a program director. And not everyone is going to be able to pull this off. We may lose some educators as we go on in this, and not just the older educators or stubborn educators. I've seen people become almost prophets in the flipped classroom, but I've seen others that have flat out refused. And I think that probably a challenge for you as a program director.
It is. I mean, in our area in Western Pennsylvania, I don't see a lot of people willing to embrace this. Um, Even the classes that we sponsor as the Ed Institute, they seem reluctant to change, and I think it's Part of it is they feel comfortable with what they've done in the past. But then when you ask them, or when you look at results, the results aren't where we need to be. I mean, we want to have more providers out in the field. Well, if we can't get people to pass the exams, then we're not going to get more providers. This idea
And
that we as the educators are the gatekeepers of that information. Why does a student have to say that Dan or Chuck is the only one that can tell me what I need to do to pass this exam? We're not going to be there when they're taking care of a patient. So we need to be able to foster these providers, these clinicians, to think critically, so that when they're given a difficult situation or a difficult patient that doesn't follow the cookbook method here, that they can actually take care of the patient and they understand why they're going to do a treatment for that patient.